Hey guys, welcome back to Medical Coding with Blue. Today's episode is all about setting professional goals for 2025. If you're brand new to my channel, welcome. I am Blue. I'm a medical coder. Okay guys, so if you are in the health information industry, meaning that you are involved in medical coding, you're involved in clinical documentation integrity, or you are involved in the revenue cycle, this video is for you. So when we talk about setting professional goals, and we are at the beginning of December 2024, okay? When we talk about setting professional goals for the next year, we talk about like, what is it that we want? Do we want to have advancement in our career? Do we want to have more opportunities to be able to do something else or to be able to branch out elsewhere? And if we want that, then we need to think about what our skill set is, okay? Before we start planning our professional goals, we need to look at our own skill set. Now, I did a video a couple weeks ago now talking about setting educational goals for 2025. This is for professional goals. So this means that if you are a coder now and you want to move up to like a lead medical coder, or you want to move up to an educator position, or if you want to move to a supervisor position, I'm talking about that. If you are a nurse and you want to transition over to CDI, I want to talk about that as well. So when we are sitting down and we're going to take out a piece of paper and we're going to write down our goal, is it that we want to be able to apply for a coding position or a lead coder position or a supervisor or CDI or whatever? You need to write that down. Now we need to look at how can we get there? We need to look at how we can get there and what is our timeline. Now, obviously, these are 2025 goals, so you can spend as much time as you want to. If the whole year is going to be about preparation so that you can get into 2026, that's okay. However you feel that you need the time. A lot of these goals, if you're already in the industry, can be achieved reasonably within 9 months, as far as like if you want to move up into a leadership position. A lot of people don't have the professional maturity to move on if they're not looking at their own skill set and, you know, gauging that, and then looking at their weaknesses and strengthening those weaknesses so that when they do apply for these positions, they are going to be better prepared. There's a lot of people that are unprepared, and then they get all flustered, or they become a mean boss, or they become, you know, an incompetent CDI or something like that. There's a lot that can happen if you get thrown into a position that you're not prepared for, all right? And so what I'm trying to talk about today is, okay, if we know that this is going to be our professional goal, let's talk about how do we get there. So setting a timeline, if you say, okay, starting January 1, I'm going to work 9 months to get this. I'm going to do everything that I can as far as like taking professional classes, as for like speaking and things, or if I need to take a writing course because I'm not so good with writing. There's a lot of videos on YouTube that talk about writing. And I say writing because writing is very important. I see so many stupid mistakes, and I'm going to call them stupid because they are stupid. These are stupid writing mistakes, and I see them made by professionals. That should never be. Misspelled words, words that are lowercase when they should be capitalized, names that are lowercase and should be capitalized. And I'm like, are you freaking kidding me? Misspelled words all the time. Instead of, spelling out you, Y-O-U, they spell out just the letter U. And I'm like, are you kidding me? And you want people to take you seriously? So again, this video is about, okay, we need to talk about our skills, and okay, we need to make that list. There's our professional goal. We need to list our strengths and we need to list our weaknesses, so that way we can concentrate and focus on those weaknesses. If you know you're coming in with lots of experience, where is your weakness? Okay, well, Blue, I don't like to stand up and talk in front of people. Okay, good. That you need to improve on public speaking. So what do? And then that's the next section of our plan is what can we do to remedy the speaking problem? If it's a speaking problem, let's go with that as an example. Now I know I talked about writing, but we're going to get into that in a second. I just want to get to this while I have it in my head. So when we talk about the speaking problem, we can go on YouTube and we can search for videos about public speaking. We can go online and we can go through Google. We can look at we can look at articles about public speaking as well. There's lots of them out there, okay? And it's the same thing with writing. If we don't write very well, if we have a problem with our grammar and that kind of thing, again, we need to resource YouTube and look at videos about writing and writing professionally, writing well. So you can subscribe. This is not an ad for Grammarly, but I love Grammarly. I personally use Grammarly all the time. And so it helps me. And I trust me, I've become a better writer since I've had Grammarly. And I like it. I really do. And it's just very helpful. It's the way that my words come across now is a lot more thorough. And I really like that. So if writing is one of your problems, that's one of the things that you can write down, okay? And that's one of the things that you could say, okay, well, this is my resource. This is how I can fix this, okay? That's how we know, okay? And then, of course, the timeline, setting that timeline. So we can set those goalposts throughout our timeline. And we can do that check-in for ourselves to see where we are. If we know that in 9 months we want to be a better public speaker because we have the experience of being a coder and we want to be a coding supervisor now. Okay, you got 9 months. All right, so if let's say 9 months down the road that coding supervisor position opens up, okay, what have we been doing to better ourselves? So if we have been working on public speaking, we're taking that 9 months and we're breaking it into quarters. We're doing a check-in twice. We're going to see, okay, I've been watching these videos about public speaking. I've been doing my practices of speaking to people just randomly so that way I can get out of the shyness, because that's all it's going to take. Even if it's saying hello to the cashier, or when you go in, you walk into a store, you see somebody there, oh, hello, how are you, that kind of thing. I'm not saying to talk to anybody and everybody, but what I am saying is to look for those opportunities where you can practice that public speaking. And even if it's, maybe you have to go to somebody in your church to say, I need to practice on public speaking. Can I, speak with a small audience, that kind of thing. Whatever you need to do. And it doesn't have to be the church. It can be any group that you're in. If you're not in a group, that's okay too. Anywhere that you can see the opportunity to speak to more than one person, and then you can practice looking them in the eye, and you can practice being in the moment and that presence, so that way it's not so foreign to you when you apply for these supervisor positions as a coder, okay? And the other thing is, that's going to help you with your personal, interpersonal skills and things, because that's something that you have to have as a leader, okay? Anytime you get into leadership, you have to have good interpersonal skills. You have to be able to show empathy. You have to be able to have that. It's a good skill to have, because there are one too many. And I say one too many because one is too many. One too many micromanagers out there in the health information universe even, okay? Not everybody, but the thing is, I've worked under some great leaders. I've worked under some terrible leaders. And being micromanaged is the one thing, there's just no reason for it. There's no reason at all. Absolutely none whatsoever. That's a sign of an immature leader. That is a sign of a leader that does not know what they're doing. And that is going to lead to a department that's not going to be run as efficiently as it can be. So if you feel like that's part of your thing, like you always feel like you have to be in control and people have to do what you say, that's another thing that you can work on for yourself, is that not everything is always going to be in your control. And you have to be able to let the people that are in that department that have already been hired, you need to look at them, each one of them, and be able to spot their strengths and their weaknesses. You need to be able to show that you can, harness those skills, harness those strengths, and it help that person improve their weaknesses. So that way you have a more efficiently run department. You have people who are going to be excited to come to work. You have people who are going to be just, more engaged with what they're doing. It's very important, guys. And again, you can see the professional maturity versus the professional immaturity or they don't have immature, they're not mature yet, you can see that in people. So that's something that you have to be able to recognize in yourself. And you can ask other people around you, you know, do you think, what kind of person do you think that I am, as far as like, do you think that I need to be in control all the time? And if a lot of people are telling you yes, if your friends tell you yes, then you know that's something that, okay, maybe I need to work on that. Maybe I should work on that. Or maybe I should work on how I communicate. Some of us come off as more blunt than others. Now, obviously, guys, you might be thinking, Blue? No, hold on. When it comes to this is my home environment, so I'm going to be a little bit more relaxed. And plus, a lot of times when I feel like I'm too nice, a lot of y'all don't want to listen. And the second that I start saying, okay, this, and this, and I'm a little bit more blunt and to the point, some people don't like it and they leave. It's fine. I don't care. But for most of you, you're like, oh, Blue, I needed to hear that. Thank you. You know, so, you know, I go based on what my audience needs and what they're telling me. Okay. So with that said, you have to understand that when you are in the professional environment, that it's all about improving you so that you can be the best that you can be and that you can help others to be their best. Because if you are not willing to do that, you have no business being in leadership. You have no business at all being in leadership. If you want to hold everybody down, if you want to discourage people, if you get jealous of people, there's no reason for that. You always need to be encouraging for your staff. You know, if there was more people like that, can you imagine what kind of industry we would all be in? But that's the thing, you know, it really all depends on you. And getting into this, and this is what you know you need to do, all right, is to set that timeline and start doing those goalpost check-ins. Start working on improving yourself. If you feel like everything upsets you, if you get so scared, you need to work on that. Why do you get so scared? Is it just you in your head, or what is going on? Are you not getting out and moving around enough as far as like getting exercise? Sometimes people will just sit and drink caffeine all day, and then they feel so jittery, and then they get agitated, and then they're just like, I don't know why I'm like this. I feel like I get so nervous, because you have a lot of caffeine and you're not moving around, you know? So that's something that you got to use common sense there, guys. and again, when you're trying to set these professional goals, it's looking at the whole package. It's not just looking at your knowledge base, because that you got with the educational goals. But when it comes to your professional goals, okay, what else do we need to improve on? Do we need to improve on our public speaking? Do we need to improve on our writing? And practice it. And don't say, I hate writing. Stop saying that, because that's part of what we do. And even if you are a coder or you are all the way up to a leadership position, you need to write. You need to write. And there's just no excuse for poor writing. I'm just saying. And again, there's no excuse for poor public speaking either. That I will say. But yes, set those professional goals and look at what you need to do to get there, because that's what's going to be able to propel you and keep that vision that you have for yourself moving forward. If you are thinking that you want to pursue, let's just say, CDI, right? You want to pursue CDI? What else do you need to do professionally to get you there? If you are a nurse already, you're coming over from the nursing side, and you want to pursue that CDI, you need to be pursuing medical coding first, because that's the only way that you're going to be able to understand what's happening in the coding. And that's part of your job, because a CDI, clinical documentation integrity person, right? They are going to be the person that's going to be right in the middle of the provider and the medical coder. The medical coder is going to come to you and ask you or say, hey, I need help with this because this provider's not documenting this. And if you are a nurse CDI and you say, oh, that's not necessary, and you dismiss that coder may have a legitimate claim, or they may not, depending on if that CDI knows. But if that coder has a legitimate claim and that provider is not doing it, and you in the middle of the CDI are agreeing with the provider because that's what you think you need to do, again, you're in the wrong. So if you are in CDI, there is no reason that you should not be learning medical coding as well. That is a professional goal to set. And you want to get a medical coding certification because you should have that knowledge. And it's the same thing that I tell my people that are trying to get into, they get the degrees, right? The associate's degree or the bachelor's degree, the associate's degree in health information technology, the bachelor's degree in health information management, either one of these. And they think that they need that for coding. No, that is for our leaders. It's not for coders. Now, the associate's degree, they're more on like the lead medical coder, the educator, and things like that, though they can run whole departments. But again, what do you know about coding? Because the coding is a very small portion. Now, in the registered health information technician side, there's a little bit more, not very much. It's a little bit more than the manager side, because the manager side, it is a very small portion. Again, if you're getting into the degree programs because you want to be in those leadership positions, you want to be in the C-suite, then you should still know medical coding. There's not an excuse. Oh, well, I don't need to do that because I'm the leader. Okay, but if your staff needs to ask you a question or you need to be the tiebreaker and you don't know what you're doing and you're just going to side with your supervisor staff because that's what you think that you need to do, again, you're in the wrong. Because it's just because you don't do that on a daily basis, everything that you do surrounds those codes. And if you are not able to spot if there's something going wrong, if you're not able to interpret what the data reports are saying, I don't know that because my coding staff takes care of that and I just take care of the business side. Yes, but you still need to know it. There's not an excuse to not know it. There's not an excuse in this whole world not to know that. None whatsoever. So that's my personal advice, because I would like to see more efficiently run departments, people who know and who are well-rounded in their knowledge. People who say, well, that's not my job, I don't do that, doesn't mean that you can't know what's going on. It's not my job to know about what happens in surgery. However, because I do know what happens in surgery, because I've done plenty of research and I read all these articles and I watch the New England Journal of Medicine, I do all of these things, it has helped me to better understand what I'm reading when I work same-day surgeries. I'm just letting you guys know. I'm just letting you guys know that having the open-mindedness to knowing not just what you do, but what others do around you, that's going to make you even more a fantastic professional. And we need that in this industry. We really need that. Because again, the person that knows all about these different things and everything in their department, that's going to be a well-run department. That's going to be a very good institution to work for. I'm just saying, because I've seen it. I've had the pleasure of being with somebody that knew about every single position that her staff did, because she did it all herself at one time. And now she runs the department. And to see her be able to do all of that and understand everybody's situation as far as what they do and their job duties and their job description, that is a well-rounded leader right there. You can't get any better than that. That's the Stepford, the Stepford leader, because that's the one that knows everything. Okay? So again, if that's a professional goal that you want to have, and this same person also has done a lot of work to making herself improved and better, and so that she can do all of these things, and that's really something to be admired. Okay? So that's the thing that I want to tell all of you. When you're setting these professional goals, you need to look at everything and set those goalposts with your timeline, so that way you know when to check in if you're falling behind, if you're lagging on your motivation to pursue these goals. That's the other thing too. Are you doing that? Are you lagging because no one's encouraging you? No one has to encourage you. It needs to be you. You need to be the driving force behind all of your goals. Is it nice to have people out there that will encourage you? Absolutely. Is it necessary? Absolutely not. Absolutely not. We are all getting too dependent on other people's validation. And if you don't need other people's validation, you are a very strong person. But if you constantly need that, as far as like, I can't move without, people encouraging me and doing all this stuff, or I'll lose motivation if I don't have somebody pushing me. We need to work on that, folks. Okay. That's something that you need to work on, because again, that's not ever going to help you to be like that, where you're so dependent on others. You need to be self-sufficient. You need to be independent. You need to be able to work autonomously. And that means pushing for these goals that you set for yourself autonomously as well. Just saying. But with that said, whatever your goals are, make them realistic. Really set one or two. Don't set so many that it becomes overwhelming. That's what people do, is that they set all these goals. They get real, gung-ho and ready to go and things like that, especially January 1. January 1, what happens? We always see everybody, there's a ton of people in the gym, and everybody says, oh, this is going to be the year. I'm going to really get it. This is going to be my year. You can do that at any time, guys. You don't need a date on the calendar to start this. You can listen to this message today, and you can say, you know what, Blue, I'm going to do this. And it doesn't have to start on January 1. I'm going to start doing it right now. And I'm going to start my goal setting today. And I'm going to set my date for completion for next year. And then I'm going to be able to, move forward and do what I need to do. Whether it is watch these videos, join Toastmasters, not an ad, but, something like that, where you can get that practice in and you can get a skilled ear to listen to you when you're speaking. That's the other thing too. Those are those professional goals, and you will see yourself become more like, okay, and it may ignite a fire in you, but you can do that anytime. You don't need the start of January 1 to be able to do that. You don't need that. You can do it at any time. But again, these are goal settings. So pick one or two things that you really want to do. And then once you've achieved those goals, then look back on your list and say, okay, well, I wanted to also do this. Okay, well, here's this. So how am I going to get there? What do I need to do? What do I need to do? Is it a time thing? Is it a money thing? Is it, if it's a money thing, is there resources that are free that I can use? YouTube, the public library, all of those things, guys, they are out there. They're out there. And if you are curious to find people to help you, to coach you and things like that, there's tons of resources also on LinkedIn. So you have options out there. You have the ability to be able to make and create the life that you want. Your job does not have to be miserable. If you say that you want to branch off and do something else, don't let anybody stop you. I've seen a lot of billers get caught up into that, where they do billing and they say they really want to do coding, and they never leave out of that billing because they get really nervous. They don't know, and they're not sure themselves because they've gotten so used to this. If you get really used to something, that complacency is the thief of your dreams right there, because you got real complacent. And then if you try to tell your boss, hey, I want to pursue coding, and then they say, oh no, and they try to convince you to stay, and then you end up staying because you feel bad. Guys, if heaven forbid, if anything happened to you, your position will be open the next day. So that's why I'm telling you guys that you have to, when you're setting these goals, you need to think about yourself. And you need to think about, how can this improve my life? Because we get one life and it goes just like that. By the time you know it, it's done. And you're going to have to look back on your life and see, did you pursue the things that you wanted to pursue? If you are a biller and you want to get out and you want to get into coding, then what do you need to do? Practice on the coding, because you're already coming in with a lot of skill with that billing, right? And so if you are practicing on the coding and then you say, I have all of this billing experience, but this is what I did when I was a biller, and this is my exposure to codes, and did I have to update these codes? Did I have to add modifiers? Did I have to do any of these things? Did I have to do the corrections? You need to put that on there, because that's, in some cases, some of you guys are doing the billing and the coding and you don't even know it. You don't even know it. So that's what you need to look at, and that's what you need to put onto your resume, your one-page resume that only goes back 10 years, 10 or 15 years at the most. And so that's when you're out there and you're applying, you say, well, yes, I've been a biller, but I've been practicing, I've been doing my studying for coding and things. I have my certification for coding. I just didn't use it because I got into billing first. And then when they give you that assessment test, and you could pass that assessment test because you listened to me and because you've been practicing and you've been, using your real world experience as well. And guess who got the job? And professional goal achieved. Hello. Professional goal 2025 achieved. Then you can write down, or you can get from your list of goals, and you can write down another goal that you want to achieve because you just achieved your goal. And just as you were a new person in that one position, and you learned everything within a month or two, again, you may have to go through that again, but it's a temporary pain to go through that's not going to be long term. Okay? Nobody wants to be the new person. Nobody wants to be the new person at all. But again, it's just a temporary discomfort for whatever advancement that you want to achieve. Okay, that's just what I'm going to say there. So, with that said, set the goals. Set your goal. Make it specific. Make it specific. The more specific you are, the better off you'll be. Just create a timeline for however long you want to take for that goal. Okay, if it's half of 2024 or 9 months of 2024, that's okay. Set that goal. And then write out all the steps that you need to take to be able to do that. Whether it is apply for the position, update your resume, or take a class, whatever the case may be, write all of these things down. Set those goalpost check-ins to see, are you still pursuing what you need to be pursuing in order to achieve your goal? Okay, that's all it is to it. I'm just saying. But with that said, I'm going to go ahead and wrap this one up. Best of luck to you guys on your goals. And I'll talk more about goal setting and things. And I'll talk more about keeping goals to yourself. Okay, we need to talk about that. Just saying. But I will talk more about that in another video. If this video helped you, please like, subscribe, and share. And I'll see y'all next time. Bye.